Exercise science has discovered something uncomfortable about stubborn thigh fat. A significant portion of this fat isn't stored just under the skin, it's embedded inside weakened muscle fibers, a condition researchers call intramuscular fat accumulation. And according to recent studies, this type of fat barely responds to calorie reduction or steady-state cardio exercise. It responds to muscle remodeling signals most people never activate. Today, I'm going to show you the exact stimulus that targets this type of fat, why science says it works, and how you can start applying it this week without endless workouts or extreme diets. This is the most effective way to burn inner thigh fat, what cellulite hates. But before you chase calories or endless cardio, hear this. Your thighs aren't failing you because you're weak-willed. They're holding on to a kind of fat that lives inside the muscle itself. To change them, you must fix the muscle first. Measure strength, not the scale. If you want the full exercise demos and a ready program, subscribe or check the link below. But stay with me for the exact step-by-step strategy you can start this week. There are 4 common places fat shows up in the body, and each behaves differently. Subcutaneous fat sits under your skin, the cushion you can pinch. Visceral fat stacks around your organs and is the metabolically active danger zone. Fat in the liver shows up as fatty liver and disrupts metabolism. Then there's intramuscular fat, also called myosteatosis, which is fat infiltrating between and inside muscle fibers. Picture a cut of Wagyu beef. That marble pattern is desirable in steak, but inside your muscles, it means the muscle has been replaced, at least in part, by fat. That's what makes inner thigh fat and cellulite stubborn. It's not always a layer sitting on top waiting to be burned. Much of it is inside the muscle itself, lowering the muscle's ability to contract, to burn fuel, and to recover. When that happens, simple dieting and cardio often fail to deliver the visual changes people want. How does this happen? The chain usually starts with inactivity. Over months and years, lower activity levels cause subtle losses of muscle mass. Muscle fibers that aren't challenged atrophy. The body fills the space with fat and connective tissue. That intramuscular fat contributes to insulin resistance and impairs mitochondrial function. Mitochondria being the little power plants inside your cells that burn fuel efficiently. As mitochondria falter, cells become more likely to store fat instead of burn it. Inflammation and microscarring can set in, further limiting muscle repair. The result is a vicious cycle. Weaker muscle, more fat infiltration, worse metabolism, less capacity for exercise, and more fat. That's why the usual advice, eat less, do more cardio, often leads to temporary scale changes but not the reshaping of the thigh region. You can't out-cardio a broken engine.
You need to repair it. So what's the strategy? Simple in concept, layered in practice. The priority order matters. Build and repair muscle first, then layer in metabolic tactics to pull intramuscular fat out. This is not instant. Expect months to years. But this is the clearest path to long-term change for inner thigh fat and cellulite. First pillar, targeted eccentric strength work. Eccentric means the muscle is lengthening under load, the controlled lowering phase of a squat, for example. Eccentric contractions produce high mechanical tension and signal the muscle to remodel and grow. Because myosteatosis is inside the muscle, you need the most potent stimulus the muscle can receive to coax that tissue back into functional muscle. That stimulus is progressive eccentric overload. Here are 5 practical movements you can use immediately to target the inner thigh and surrounding muscle groups with execution cues you can apply today. Slow squat descent with a controlled 3 to 5 second lowering phase, then an easier, faster ascent. Imagine sitting back into a chair slowly. Use weight that allows controlled descent at that tempo. The eccentric phase is where the signal happens. Negative split squat. Step into a split position. Lower the back knee slowly for a 3 to 5 second count, then use both legs to come up or push up with the front leg. Focus the slow lengthening on the front leg's inner thigh and quadriceps, maintaining knee alignment. Controlled step downs from a box or step. Stand on a 6 to 12-inch platform and slowly lower your trailing foot down to the floor for 3 to 4 seconds, emphasizing control rather than hopping down. This unloads the step up and focuses on eccentric control as the weight shifts through the stance leg. Walking lunges with an emphasis on a slow, controlled lowering into each lunge and deliberate push-off. Take each step in a manner that the front leg lengthens under tension as you descend. Single leg Romanian deadlift with a slow hinge and controlled lowering phase, keeping the standing leg soft as it lengthens. This one targets the posterior chain and inner thigh stabilizers in a complementary way. If you're newer to strength training, start with body weight or light load, focusing on tempo. For intermediate lifters, add external load, dumbbells, a kettlebell, or a barbell, while preserving the eccentric. Aim for 3 sets per exercise initially, working toward 3 to 5 sets as you adapt. Repetitions are best kept in the 6 to 12 range when hypertrophy and remodeling are the goal, but make the lowering phase slow, 3 to 5 seconds eccentric, then controlled concentric return. For single leg movements, 6 to 10 reps per side is a good starting point. Frequency is crucial. Do eccentric-focused strength sessions 2 to 3 times per week with at least 48 to 72 hours between intense eccentric sessions for the same muscle group.
Eccentric work causes more micro damage than concentric work, and that damage is the signal for repair, but it also requires longer recovery. Do not perform maximal eccentric sessions every day. If you want a higher training frequency, split the load across different modalities. For example, 2 focused eccentric strength sessions and 1 light mobility or activation session in the week. Expect soreness initially. That's normal. If soreness is extreme or persists beyond a week, reduce volume or intensity and extend recovery. Progressive overload matters. Increase the challenge over weeks and months by adding weight, adding reps, slowing the eccentric tempo, or increasing time under tension. Track the load you used, the tempo, and how many clean reps you did. Your clearest measure of success will be strength increases. If you're lowering a heavier weight slowly with control or doing more reps at the same tempo, that's remodeling happening. Second pillar, walking and activation. Walking is underrated for this specific problem. Post-meal walks, for example, help shuttle glucose into working muscle rather than storing it, which improves insulin sensitivity and reduces the tendency to top up intramuscular fat stores. Start with a 10 to 20-minute walk after your larger meals. Aim for daily step count increases. If you're at 4 or 5K steps, add 2 to 3K steps progressively. Walk briskly enough to elevate heart rate modestly, but keep it sustainable. This is not high intensity, it's metabolic and insulin sensitizing. As your strength improves and you tolerate it, layer in graded high-intensity work, short sprints or interval sessions once weekly, progressing to 2 sessions per week depending on recovery and baseline fitness. These sessions are powerful metabolic stimuli and recruit fast-twitch muscle fibers that are often underused in low-activity lifestyles, but they're also risky if done too soon or too intensely. Begin conservatively, 6 to 10 short sprints of 10 to 20 seconds at near-max effort with 60 to 90 seconds of walking recovery between sprints, or short bike intervals if impact is a concern. Only progress intensity and volume gradually, and avoid combining maximal sprints with heavy eccentric strength work within the same 48 to 72-hour window. If you have cardiovascular risk factors, joint issues, or are older or frail, get medical clearance before attempting sprint intervals. Third pillar, nutrition and meal timing. The metabolic environment you create through eating matters for where your body stores or burns fat. The approach that best complements the training priorities here reduces meal frequency and shifts toward lower carbohydrate intake during active rebuilding phases. Practical options are 2 meals per day or 1 earlier dinner, sometimes called early time restricted feeding, which reduces late night eating and long postprandial insulin exposure.
For many people, 2 meals a day can blunt insulin peaks, reduce the overall insulin load, and encourage the body to use more intracellular fat stores during fasting windows. Periodic prolonged fasts, 48 to 72 hours, can further trigger cellular cleanup processes like autophagy and increase the mobilization of intracellular fat. However, these fasts are not for everyone. Consider them occasional tools, not daily practice. If you use 48 72-hour fasts, do them with planning. Avoid intense strength workouts during the fast, stay hydrated, consider electrolyte support, and consult a clinician if you're on medication, have diabetes or metabolic disease, or are pregnant or nursing. For most people, a safer entry point is intermittent fasting patterns, like 16-8 or 18-6 day-to-day, with an occasional, well-supervised extended fast if appropriate. A low to moderate carbohydrate emphasis during the active muscle rebuilding phase can help with insulin management and facilitate intracellular fat use. You don't need to be extremely low carb unless it suits you metabolically. Instead, prioritize reducing refined carbs and timing higher carb meals around training sessions to support performance and recovery. One clear early sign that your metabolism is shifting is appetite change. Many people experience reduced hunger and fewer cravings as they adapt to lower meal frequency and improved insulin sensitivity. That's not a magic indicator on its own, but combined with improving strength, it's a useful, practical sign that cellular fuel handling is changing. I'll be transparent about the timeline and evidence. In short-term studies of combined approaches, dramatic weight change is often absent even when muscle quality improves. For example, in one 12-week intervention of similar strategies, there was no weight loss, but a measurable 15% reduction in muscle loss, meaning muscle quality and preservation improved even without the scale moving. That's why the scale can mislead. Early wins will be functional. You'll sit down and stand up more easily, lift heavier, and maybe notice your hunger decreases. Visual changes in thigh shape and cellulite can lag behind for months or longer because the machine needs to rebuild from the inside out. Supportive factors are non-negotiable. Sleep is where much of the rebuilding happens. Target consistent, adequate sleep. Aim for a schedule that gives you restorative, uninterrupted sleep, because growth hormone and many repair processes are tied to deep sleep cycles. Without it, even the best training program underperforms. Nutrients to prioritize include magnesium, vitamin D, and omega-3 fatty acids. Magnesium helps with muscle relaxation, sleep, and insulin sensitivity. Vitamin D supports muscle function and systemic health, and omega-3s have anti-inflammatory effects and may support mitochondrial function. Present these as supportive, they aren't cures.
Check levels with your clinician if you suspect deficiency, and don't self-prescribe high-dose protocols without guidance. Cold exposure can be a useful adjunct to stimulate metabolic heating and mitochondrial activation. Short, controlled local cold plunges to the waist or cold showers can increase metabolic demand and help with recovery for some people. Start conservatively, brief exposures of 30 to 90 seconds after workouts or as tolerated, and avoid prolonged deep cold if you have cardiovascular issues or poor circulation. Cold should be an option, not an obligatory step. A practical weekly template to sew all this together might look like this. 2 focused eccentric strength sessions per week, separated by 48 to 72 hours. Each session, 3 to 5 exercises targeting the thigh and surrounding musculature, 3 to 5 sets per exercise, 6 to 12 reps with 3 to 5 second eccentric phases. Includes single leg work once or twice weekly. 1 light skill/activation day. Mobility, short controlled loaded carries, or tempo-focused unilateral work with lower volume. Daily post-meal walks, 10 to 20 minutes after each main meal, and a step increase goal for incidental activity. 1 graded high-intensity interval session per week once adaptation allows, progressing slowly. Dietary pattern, 2 meals per day or early dinner OMAD for those who tolerate it, with carbs targeted around workouts. Consider intermittent fasting daily with an occasional 48 to 72 hours supervised fast every couple of months if safe and advised by a clinician. Because eccentric work is more damaging to muscle tissue on a per-session basis, respect recovery. If you plan 2 intense eccentric sessions, pair one with later light cardio or mobility days, not another heavy eccentric session. If you do a prolonged fast, expect to skip heavy lifting during that window and plan your recovery accordingly. How will you measure progress? The best metrics are functional and behavioral, not just the scale. Track increments in strength. Can you lower a heavier weight slowly with control? Can you do more reps at the same tempo? Use objective tests like a timed single leg squat depth, step up height and repetitions, or a baseline loaded carry time. Track appetite and hunger signals. Many people notice reduced snacking and more controlled hunger as they improve insulin sensitivity. Monitor clothing fit. Sometimes pants feel looser clinically before the mirror tells you anything. Use photos sparingly and spaced out. Weekly photos can mislead because of water fluctuations. Think in months, not weeks. Safety and modifications are essential. If you're older, have osteoporosis, cardiovascular disease, diabetes on medication, are pregnant or nursing, or have other significant health issues, get medical clearance before starting eccentric overload, prolonged fasts, or intense sprints.
Modify eccentric load with tempo and assisted movements. Use a TRX or rail for assistance, reduce external load, or perform partial range of motion variants until you build capacity. If you have knee pain, prioritize movement quality and consult a physical therapist to ensure you're using safe mechanics. Do not ignore pain that's sharp or persistent. Soreness is expected, but pain signaling injury is not. Let's address some likely questions you have now. Will this make cellulite disappear? No, I won't promise that. Cellulite's appearance is influenced by connective tissue, subcutaneous fat, and intramuscular fat. By rebuilding muscle and improving local metabolism, you remove a major component, the myosteatosis, and you may improve skin tone and circulation, which over time can reduce the dimpled appearance. But that takes consistent, months to years effort and realistic expectations. That's why I emphasize strength and functional metrics first. Should you do endless squats and cardio every day? No. That can worsen recovery and perpetuate the cycle. Quality eccentric work with recovery beats high-frequency, low-impact cardio for this problem. Walking daily is excellent. Save intense sessions for scheduled intervals and respect recovery windows. What about supplements or topical creams? Use magnesium, vitamin D, and omega-3s as supportive measures. Topical products may help skin appearance transiently, but the long-term change comes from structural remodeling of muscle and improved metabolic health. How often should you reassess? Reassess strength every 4 to 8 weeks. If you're increasing load or reps predictably, that's progress.
Reassess body composition or photos every 12 weeks to allow time for meaningful changes. A few practical troubleshooting tips. If you hit a plateau in strength, check recovery and sleep first. Often the issue is insufficient protein intake, inadequate calories around training, or accumulated fatigue. If hunger remains high, split your meals differently, or ensure the pre-training meal includes adequate protein and fats. If you can't tolerate sprints, substitute low-impact intervals like bike sprints or rowing to keep intensity without joint stress.
To recap the takeaways, you should start applying immediately. Prioritize eccentric, slow, progressive strength work for the thighs 2-3 times a week. Add daily post-meal walks and increase step count. Progress to graded sprints or interval sessions when your recovery allows. Use reduced meal frequency and targeted low-carb timing to support intracellular fat use. Consider occasional supervised 48 to 72-hour fasts as a tool, not a rule. Prioritize sleep, magnesium, vitamin D, and omega-3s. Use cold exposure conservatively if appropriate. Measure progress by strength, appetite reduction, and functional changes rather than short-term scale fluctuations, and always modify for safety, especially if you're older or have health conditions. This is the most effective way I know to change stubborn inner thigh fat in a durable, physiologic way because it attacks the actual cause, intramuscular fat, and a weakened muscle engine. It's not quick, but it's the path that lasts. If you're ready to start, begin this week by adding 2 slow eccentric strength sessions with the movements I described and a 10 to 20-minute walk after your next large meal. Track one strength metric, for example, the weight you can lower slowly for 3 clean reps, and check it in 4 weeks. That simple start will tell you whether you've got the basics right. If you found this helpful, watch the related video on hip fat and mechanics next and subscribe for the full training series with demos and progressive programs. Fix the muscle first, be patient, and the rest will follow.